This is Coach Matt with Lifelong Recovery. In this video, I'm going to talk about the importance of taking care of your mental health and recovery. So, a lot of people, what I've found over the years working in treatment and dealing with my own recovery, as well as what they call co-occurring disorders, is that a lot of people kind of take care of one problem and not the other. So, what I mean by that is maybe they're trying to address their mental health issues such as depression or anxiety or things like that, but they're not treating the substance abuse. And vice versa, maybe they're treating the substance abuse, they're working on their addiction recovery, but they're not necessarily treating some of these underlying disorders, some of these kind of what they call them co-occurring disorders, like depression, anxiety, PTSD, bipolar disorder, this, that, and the other. So they're not being medically managed or just seeing a mental health professional to treat those. So I've seen a lot of people that are working hard on their recovery. They're working some kind of program of recovery, which usually entails some level of getting regular support and talking about their issues and working on themselves and trying to live by specific values and just, kind of these things that make the recipe for recovery. However, their co-occurring disorder is not being managed. So that causes them a lot of times to end up relapsing because it's difficult living with any kind of mental health disorder, but if it's not being treated, then it makes staying clean and sober very difficult. So the first thing I want to throw out there is some statistics about co-occurring disorders with substance abuse. So around 50 to 60% of people with a substance use disorder have some kind of co-occurring or multiple co-occurring mental health disorders. I was just talking about the depression, anxiety, PTSD, bipolar, borderline personality disorder. There could be a whole host of different things that are, again, co-occurring, meaning it's occurring at the same time as the substance use disorder. The second thing is that the more severe the substance use disorder, the more likely there is a co-occurring disorder. So something kind of interesting about this, I used to think that, and I think there's kind of a stereotype that people become addicted, a lot of times because of mental health disorders. And this does happen. That is true in some circumstances. But what they found through research is that more often than not, the two most common co-occurring disorders with substance use disorder, which are depression and anxiety, that depression and anxiety are more often caused by the substance use disorder rather than people becoming addicted to a substance to what they call self-medicate the depression or anxiety. So this was really surprising to me. So more often than not, depression and anxiety is actually caused by the substance use disorder than the other way around. So that was something for me that I was surprised to find out because that was one thing that I was always wondering when I got in recovery. Looking back, I started struggling pretty significantly with depression and anxiety around the same time that I became addicted to substances. So it was always like a chicken or the egg kind of thing with me. I didn't know which came first, the depression and anxiety or the substance use disorder. So again, what they found through research is that more often than not, the depression and anxiety are a result of the substance use disorder. So the next thing is the more severe the addiction, the more likely a co-occurring disorder. And so what that typically looks like, the most common is depression. So that happens in 30 to 40% of the cases of substance use disorder. Anxiety happens in about 20 to 40%. And then PTSD happens in about 30 to 50%. So the interesting thing about PTSD, what I found is in my own experience with addiction and just talking through other people, the deeper I get into substance use, the more likely I am to experience PTSD. So, of course, this can look 1,000 different ways, right? A lot of times when people think of PTSD, there's a common kind of conception of war. That's probably the biggest thing that you hear when the average person thinks of PTSD. That's what comes to mind. So obviously, it can come from a whole host of things. So to give an example, the deeper I got into substance use, the more consequences and just negative things that started happening to me. So for instance, I got myself into dangerous situations. So going and buying drugs. So for a time, I wasn't a big level player in the game or anything like that, but I started selling weed, and I would buy up to like probably a half pound at a time. And even, what, I mean, that's probably considered like lower levels, but I was finding myself in uh, just dangerous situations. People obviously carrying guns and being paranoid, and just it just, and this was as like a teenager. I was um 17 years old, so just finding myself in scary situations. I remember one time I was buying weed from this guy, and I think I was buying like a quarter pound or a half pound, and his so what's pretty common is if you are buying drugs, that you're probably gonna, the person selling it to you, especially if you don't really know them, if you're being introduced by someone else, they probably are going to want to do the drugs with you to make sure that you're not a cop or a snitch or whatever. So anyway, we're sitting at this guy's house, me and a buddy of mine that I went to school with. He was the one who introduced me to these guys. And so we're sitting around smoking a blunt before basically I make, before I buy the half pound or whatever it was. And he just starts getting really paranoid, and he just he just doesn't like me for some reason, and thinks that I'm like a cop and all this shit. And I'm literally 16 years old at this point. I'm scared shitless. I mean, that was, I didn't I grew up in a middle class family. Had everything I needed, and I didn't grow up in those kinds of like situations. So, I was out of my wheelhouse, so to speak. But anyways, we ended up leaving. The guy was flipping out, saying that I was a cop and all this stuff. And I was literally just sitting there smoking a blunt. I don't know why. I'm sure just he was paranoid, probably used many different drugs. I think we got some cocaine, a little bit of cocaine while we were there too. So, that could have been the reason he could have been on cocaine. But anyway, that's just an example. And then another thing, I almost killed my friend in a car wreck. He was in a coma for 6 weeks. This again, that happened when I was 17 years old. Luckily, he's okay today. But just a very traumatic, scary thing. So just to give an example of how, as the substance use develops, probably the more occurrences that create this PTSD can happen. So what I would say, guys, is please, if you have the means, go to a psychiatrist who specializes in addiction. Find out if you're not aware already, if you have anxiety, PTSD, any other, co-occurring disorder, and then you see what they recommend to treat it. And the reason I say a psychiatrist, again, to give an example from my own addiction. So when I was getting heavy into alcoholism, I started having severe anxiety, to the point where I was carrying around a bottle with me, a liquor, and drinking even in times that I didn't want to, because I was starting to have panic attacks real bad. So I went to my family doctor, and he straight up told me that the anxiety was probably caused by my substance use. Um, but he still prescribed me Xanax. And if you guys know anything about Xanax, it is extremely dangerous to mix Xanax with alcohol. So here I am. Now I've got a prescription of Xanax. I'm already addicted to alcohol. At that point, that was my only addiction, was alcohol. I would do other things periodically, but alcohol was, an all day. Basically, at that point, it was kind of an all everyday type thing. And now I'm throwing Xanax on top of that. So literally, guys, I could have died multiple times. One time, to give an example of this, one time, my mom was worried about me because I wasn't answering my phone, and we used to live real close to each other. I was about probably 25 at the time. I lived like 5 minutes away from her, and she knew, that I was struggling with addiction and stuff. But anyway, so I didn't answer my phone because I was passed out. I had taken Xanax and I was drinking, and this was in the middle of the day, right? So she drove over to my apartment, saw that my car was there, and she was worried that I was dead. Okay. So she's freaking out. She's pounding on my door. I don't answer. I'm passed out, dead to the world, basically. And she even called the cops. Now, the cops weren't allowed to legally break in, but they beat the shit out of my door. When I finally woke up and called my mom back, and her voice was quivering. She was so scared. Um, but I called her back and basically minimized, stop flipping out, Mom. Don't worry, it's not a big deal, whatever, blah, blah, blah. Um, I went outside and saw my door, and it was dented to shit. It was crazy. They were beating the shit out of my door, and I didn't wake up, and I didn't know until later that this was so dangerous. I wasn't aware of that. So again, this was a doctor that prescribed it to me. Now, granted, I was having severe panic attacks, and I part of me understands why he prescribed it, but the fact remains that that should have never happened. That was extremely dangerous. I could have died. I didn't know the severity of it, and maybe that's on me for not knowing how dangerous it was. It says on the bottle, "Don't drink with alcohol," but if you're in addiction, you don't give a fuck about prescription labels and taking doctor's advice. So anyway, so all that to say, if you have the means, please go to a psychiatrist who understands addiction. Oh, and I didn't even mention, I ended up becoming addicted to the Xanax. Xanax is extremely addictive. So it was another substance that I had to deal with when I detoxed, of getting off of. And let me tell you, getting off of alcohol and Xanax is it's not a fun thing. If anyone out there has dealt with this, you know what I'm talking about.